Thank you, Mr. Williams, and pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Committee Situation Report for today, Wednesday, November the 3rd, 2021. The COVID-19 pandemic continues to impact us globally, regionally, and locally. In terms of what's happening or its impact on the Federation, it has impacted our health system, it has impacted our domestic economy, and it has impacted social life as we know it. In terms of its effect on the health system, the pandemic has caused us to experience 3 waves of infection. Now, the 3rd wave began around about mid-August, so that's about 2.5 months now. And we've been trying to contain this wave of infections, and we have been successful. It's now under control. And this, we have objective evidence of this because we look at and we monitor the 7-day incidence rate, and at present that rate is down to 84.7 per 100,000 of the population, and this is coming from 260 per 100,000 about 3 weeks ago. Now, within the past week, last Wednesday to yesterday, Tuesday, November the 2nd, we've added 40 new COVID-19 cases to our tally. Now, this is 17 cases less than we counted the previous week. In terms of hospitalizations, only 2 new hospital admissions within this past 1-week period. We have had 6 patients being discharged, and the number of recoveries continue to increase with 194 recoveries within this past week. In terms of the deaths, we've counted 4 additional COVID-19 related deaths during this past week. In the previous week, we had 0. This past week, we've added 4 new COVID-19 related deaths. So this slide just provides us a snapshot as to our COVID-19 status on the ground currently. So as a federation, we've reported a total of 2,686 COVID-19 related cases, 434 cases reported for NEOC, 2,252 cases reported SENKITs. The number of recoveries, as I said before, continue to increase. We've counted 2,536 so far, so that leaves 125 active cases. We are very happy about this because this is the lowest number of active cases in a number of weeks. And ladies and gentlemen, we really want to keep it like this, or we even want the number of active cases to be lower than this. In terms of the active cases, 30 of these cases are being followed up in NEOC, and 95 of these cases are being monitored by the team of case managers on SENKITs. In terms of hospitalizations, currently 3 COVID-19 cases are admitted at the JNF General Hospital on the COVID ward. As we said before, to date, the Federation has reported 25 COVID-19 related deaths. So as I said, this provides you a quick summary of the COVID-19 status currently in the Federation. Now, we monitor the data with respect to the COVID-19 related deaths. As we said, 22 of the 25 died on SENKITs, 3 of the 25 on NEOC. 84% of these deaths were individuals who were unvaccinated, and you could see majority of them were 60 within over 60 age band. In other words, when you look at this data, what is this really saying to us? What this is saying is that if you are unvaccinated, if you are over 60, and I will add if you have multiple health conditions, you are at risk for one, picking up COVID, and secondly, your risk of death related to COVID is increased with these predisposing factors. So we want you to focus on this, meaning I'm speaking to those who have not yet come on board in terms of accepting the vaccine. Look at the evidence, and this is local evidence. Be informed, empower yourself to make that right decision. Now, we also monitor the data regarding those who are diagnosed with COVID-19. So when you look at the vaccination status of those diagnosed with COVID-19, 68% of these individuals are not vaccinated. Only quarter, 24.3% fully vaccinated, and 8% partially vaccinated, meaning just having one dose on board. So again, if you are unvaccinated at present in the Federation, your risk of picking up COVID is increased. Now this is the latest style as at the end of workday today. So far, 24,513 individuals are fully vaccinated, having received 2 doses of the COVID-19 vaccine. 77.2% of adults in our population have received the first dose, and the coverage rate in terms of fully vaccinated adults, 72.9%. In terms of children 12 to 17 years, 12.4% of the children within this age band have come on board and received 1 dose, and 9.2% have come on board in terms of receiving 2 doses or being fully vaccinated, having received 2 doses of the Pfizer-BioNTech vaccine. So in terms of our vaccination status, when you look at the total number of adults, children fully vaccinated, the percentage of the total population fully vaccinated equals 52%. So 52% of our total population fully vaccinated, and this includes adults, children 12 to 17 years. So St. Kitts and Nevis has achieved and surpassed the WHO threshold of having at least 40% of our total population fully vaccinated. And so this is an achievement, and we continue to maintain this momentum in terms of vaccinating our population. We have been acknowledged by the Pan American Health Organization in passing this benchmark by their penning an article that has global reach, and we've provided you the link to this article. Now, ladies and gentlemen, based on the latest report coming out of the Caribbean Public Health Agency, we now know that all 4 variants of concern of the SARS CoV-2 virus are present in the region. So just as a reminder, you have variants of concern and variants of interest. So the variants of concern, the variants that are more virulent, more contagious, and the variants of interest have impacted us. For example, the Lambda variant. So the Alpha variant was first identified in the United Kingdom. Beta, first identified in South Africa. The Gamma variant in Brazil. The Delta variant, yes, the Delta variant, we all hear about the Delta. It was first identified in India. And so all these variants are present in the Caribbean region. So even though in St. Kitts and Nevis we have the 3rd wave under control, our numbers are going down, the risk of exposure to the virus, the risk of importing any of these variants is still significant. And so we have to not let our guard down. We need to be vigilant and continue the COVID-19 prevention, public health, and social measures. This slide was sent to us from CARPHA. This just highlights the distribution of the variants. So in the Caribbean region, you have the Delta variant in circulation. So they look at all the samples they receive for genomic sequencing, and 43% Gamma variant, 29% Delta, 18% Alpha, and 3% Lambda. St. Kitts and Nevis falls into that 3% because based on the evidence we have, that's the variant that is in circulation for now in our federation. So we have to be very vigilant and continue our public health and social measures in terms of reducing our risk of exposure to the virus. So I just wanted to add some, provide you some additional information regarding long COVID. As I said last week, there are a number. So to date, we have 2,686 persons impacted by COVID. We've had 2,536 individuals recovering. Now, of these 2,536 individuals, some are still complaining of the long-term consequences of COVID-19, or what is now deemed long COVID syndrome. So these individuals, some have, shared with me one-on-one, they complain of fatigue, a post-COVID fatigue, a tiredness. So some persons have gone out to work, and then by mid-afternoon, they really have to stop because that fatigue, that malaise is compelling them to go back home. Shortness of breath, chest pain, we hear of a brain fog. So in other words, their cognitive function isn't as it was before. Sleep abnormalities, and some individuals still experience changes in terms of their sense of smell and taste. But most importantly, this slide just shows that the long COVID syndrome seems to affect multiple organ systems. So it affects your lungs, shortness of breath, chest pain, a nagging cough that is persistent. It affects your gastrointestinal system, your pancreas, your spleen, your liver, your kidneys. And so this whole COVID is real. And it's a bit complicated. So even after recovery, you have symptoms affecting or involving multiple organs. But I found this information interesting, and this is coming out of the British Medical Journal, and it really, it's trying to figure out who is at risk for long COVID. And I found this interesting. Based on the study they did, individuals who are older, so persons who are over 50, who have been diagnosed with COVID, and those with pre-existing medical conditions or comorbidities. So the greater the number of medical conditions you have, the greater your risk of long COVID or recovering and still have long-term, experience long-term effects of COVID. And of interest is the type of pre-existing medical condition. So if you have hypertension, if you are obese, if you have a psychiatric condition or an immunosuppressed medical condition, your risk of experiencing symptoms, COVID-like symptoms after recovery is increased. And so this is interesting. And so again, I would use this plug to say individuals that falls in this category. And if you have pre-existing medical conditions, hypertension, obesity, psychiatric illness, and you have not yet come on board in terms of receiving the vaccine, it will protect you from getting COVID, and it would reduce your risk of experiencing long COVID even after recovery. All right, so the management, again, long COVID is new. COVID as a disease entity is new. And so the long-term effects, the scientists are just gathering this data. And so they're just getting a handle in terms of the investigation of long COVID, diagnosis, and the management protocols for long COVID. This is just good news. Just wanted to underscore that the United States Food and Drug Administration and the United States Centers for Disease and Control approved the Pfizer-BioNTech vaccine for emergency use in children aged 5 to 11 years. Now, the dose they get is a third of the dose given to the older children, 12 to 17, and adults. Now, and this is important and this is good news. So what you have is that in the US, the children are already lining up for the Pfizer vaccine, meaning children 5 to 11 years. And the reason for this is that in countries that are experiencing the Delta variant outbreaks as a result of the Delta variant has significantly affected children in this age band. And it has caused an increase in hospitalizations and long COVID-like symptoms, even in children 5 to 11 years. And so, yes, in St. Kitts and Nevis, we've only experienced the Lambda variant, which to date has not impacted our children immensely. However, if perchance the Delta variant is imported and we have an outbreak caused by the Delta variant, there is potential for the Delta variant of SARS COV-2 adversely affecting our children, 5 to 11 years, 12 to 17 years. And so, again, we are, empowering parents and guardians of children to come on board and consider consenting to this vaccine for your child or children. All right, and so this brings me to the whole issue of contact sports and the risk of spreading the COVID-19 virus. And so we have been approached by some sporting disciplines, basketball, football, with respect to resumption of the various leagues. And so we wanted just to highlight the risk of spreading COVID-19 during contact sporting activities. And so this risk is increased by the following, or because of the following. One, direct physical contact, such as tackling or checking or face-to-face contact while, playing football, basketball. Heavier breathing caused by play intensity, yelling, grunting, and spitting, which is quite common for both disciplines. Sports activities usually require persons to be together for extended periods of time, and they also put on, remove equipment, uniforms in a space, and this may be in a locker room, etc. Participation in practice games and or transportation to and fro matches. And so these are the factors or the conditions that would increase the risk of spread of the virus while involved in these contact sports. All of these will contribute to the ready spread of the virus released in the respiratory droplets of an infected player. And the risk is even higher if the event is held indoors. All right, so I know basketball in the federation and football is played outdoors, but you have the locker rooms where the players gather before going out on the court or on the field. Now, the risk of viral transmission is even higher if the players are unvaccinated. And I repeat, the risk of viral transmission is higher if the players are unvaccinated. So how can we decrease the risk of viral transmission when you are considering sporting contact sports. Physical distancing, wearing of the face mask, frequent hand sanitization, vaccination. Now, if you were to pause and think about this, when playing basketball or football, the physical distancing, the wearing of the mask, and the frequent hand sanitizing is not practical. And so, when considering the risk of transmission and contact sports, it's the fourth factor that we have to depend on, vaccination. All right? The global data shows that transmission risk is higher for teams with low rates of vaccination. Or let me put it in the reverse. The risk of transmission is lower with teams with a high or 100% vaccination rate. And it follows logically. And so the National COVID-19 Task Force, based on medical guidance, we are making the following recommendations with regards to the risk reduction strategy. Okay, so what we are saying is that all players who are eligible to be vaccinated, they should be vaccinated. All coaches, supporting staff for these organized matches. No, I'm talking organized, official, competitive matches. They should be vaccinated. And then the spectators attending these organized, competitive matches should be vaccinated. Again, it's important for us to remember the COVID-19 public health and social protective measures. Accepting the vaccine, wearing your face mask at all times, maintaining adequate hand hygiene, and maintaining adequate distance from others. And if perchance you are experiencing any of the COVID-like symptoms, coughing, fever, nausea, vomiting, diarrhea, any of the COVID-like symptoms, do not go to work, do not go to school, do not take public transport. Please stay at home. Thank you.
Thank you very much, Dr. Laws.